Well, we are talking about the most comprehensive health system for children along the I-12 corridor, Ochsner Hospital for Children at St. Tammany Parish Hospital. So I'm interested to hear from you about inpatient resources at the hospital and how Ochsner specialists are working with us to create the most comprehensive health system for children on the North Shore.
Okay, great. We have always had the pediatric unit at St. Tammany, and we've recently added the Pediatric ICU, which is the Pediatric Intensive Care Unit. This is in collaboration with Ochsner for Children, Ochsner Hospital for Children, and we are excited that we have the pediatric intensivist with us from Ochsner. The unit is newly designed, brand new rooms, 4 rooms, pediatric ICU. In the rooms, there's state-of-the-art equipment, brand new equipment. We are able to have cardiac monitoring. We have videos in there, a video camera in there that we can watch the children 24/7. Because in ICU, it's necessary to visualize those children the whole time they're there. So we have that available. We're staffed with pediatric ICU nurses who are trained in intensive care for peds. And they come with experience from various places. We were so excited to get them at St. Tammany. And as I said, the pediatric ICU physicians staff not only the regular acute peds side, but also the intensive care side. And that's in collaboration with Ochsner and the Ochsner Hospital for Children at St. Tammany Parish Hospital.
Wonderful. So you're saying essentially that the capabilities inside of St. Tammany Parish Hospital with those Ochsner intensivists, that's the whole reason for calling it Ochsner Hospital for Children at St. Tammany Parish Hospital, because we have general pediatric inpatient care and intensive care for pediatrics. Correct. And that is a collaboration between our 2 hospitals.
That's correct.
Outstanding.
Yes. We're able to keep children that we in the past would have to send either across the lake to the South Shore, to Baton Rouge, or even out of the state. We had the capability to take care of pediatric acute conditions, but if that condition became more serious and needed a higher level of care, we would often have to transfer out from our pediatric unit or even from the emergency department. Conditions such as diabetics, sometimes they get in a crisis situation where we have to take care of them in an ICU situation. Several respiratory conditions warrant ICU, neurological conditions, things like that. Some surgeries for the first 24 hours need an ICU area.
Wonderful. So this really drastically increases the pediatric capabilities inside the hospital. Yes. And then downstairs, the hospital also has a pediatric emergency department, and that's 24 hours a day, 7 days a week. It never closes.
Correct.
Can you talk a little bit about that?
Yes. A few years ago, the emergency department underwent a whole renovation and expansion. And within that expansion, they created a pediatric emergency department. The rooms are specialized for children. They're geared towards children. The way they're decorated, the colors, the setup, the equipment that's over there. There's a separate pediatric waiting area for the emergency department. And the staff in that area, just like the pediatric ICU, are trained for children. So we have nurses who specialize in pediatric care. We have physicians over there who are staffed 24/7, as well as the nursing staff. We were at a 12-hour, staffed that area for 12 hours for a while. And when we opened the ICU, our plan was to expand it to 24/7. So anytime you come in for emergency services, with your children, you will be seen in the pediatric emergency room.
Outstanding. So at St. Tammany Parish Hospital, you have Ochsner Hospital for Children, pediatric intensivists upstairs in the pediatric intensive care unit and the inpatient pediatric unit.
Correct.
And then downstairs, the pediatric emergency department is always open, never closing, ready to see children at any time. And those 2 can collaborate with each other. Yes. On pediatric emergencies that may in the past have had to leave the area.
Yes. And what also happens, because we have the pediatric intensivists in-house, when they're there, they will go down to the ED to evaluate the patient to make sure, we'll take the patient in our pediatric ICU. There are a few cases that we will still have to transfer out. Just certain specialties are very high-level cases, but for the most part, we can keep everything on the North Shore.
Outstanding. Well, that's all inside the hospital, and then there are also resources that are part of the comprehensive pediatrics available through Ochsner Hospital for Children at St. Tammany Parish Hospital. St. Tammany has Pediatric Therapy down the street from the hospital. Can you talk a little bit about that?
We just finished building a state-of-the-art building near Flowers Estates on 21. If you drive down 21, you'll see that very easily. Very excited about the new building, and in that new building is an area specialized for children. So we have speech therapists, occupational therapists, and physical therapists who are trained in pediatric care as well. Their therapy is a little different and involves play. That's how you treat the children. All of their care is a little more specialized. So in therapy, it involves a lot of play. That gets them involved. It's fun for them. They don't think of it as work when you do that. There's indoor and outdoor areas for therapy. There's a whole separate waiting area also for the rehab department for children.
Perfect. And that pairs nicely with something we'll hear a little later in the show, the Bose Center for Child Development, which Ochsner Hospital for Children brings to our market.
Yes.
So we really have a comprehensive level of therapy, outpatient, as well as what we've talked about, inpatient.
Yes.
I think as a parent of very healthy children, my perception of pediatric care tends to be just simply going to the pediatrician.
Right.
And our partnership really has that covered well too, Mandeville, Covington, and Madisonville.
Correct.
Can you talk a little bit about the Madisonville practice?
Yes, our Madisonville practice opened, and it was an area that used to have internal medicine or primary care there. We decided to transform that into the pediatric clinic. So it's staffed with a full array of pediatricians as well as nurse practitioners. So your children can go there. It's all geared towards children. They're all experts in the field, and as an added addition to that clinic, you can have a video visit.
That's video visit. Yes. Tell me about a video visit.
That's the new and upcoming thing. You can sit in your home and have a visit with your physician. Some parents have transportation issues. It's a time issue, traveling. They may have an appointment somewhere else, so you can do the video visit from an iPad, phone, anything like that. So you can schedule the video visit appointment and sit right there and speak with your physician just like you're in the office, except it's on video.
That's perfect. So as a parent, if I see my child has some suspicious rash or something that I can't diagnose as Dr. Mom, but it doesn't feel like something I want to make an appointment and go in, I might be able to schedule that video visit.
Yes.
And have the practitioner from the pediatrician's office take a look electronically.
Yes, yes, and as a matter of fact, that was one of the first cases we did as a video visit. It was a rash. Those are easy things that can be evaluated through the video. And they're also, we're looking at adding some things for a video visit, so you can actually maybe put something in and let the physician visualize the ear, or either listen to the child, things like that. So there's some things that can be added for that.
So more to come on
Yes.
video visits.
Yes.
Well, maybe we'll do a future show about
Yes.
it. Cindy, thank you so much for coming in today. We've been talking with Cindy Ingram, Director of Women's and Children's Care at St. Tammany Parish Hospital. Up next, we'll talk with Melissa O'Malley, Assistant Vice President with Ochsner Health System, about the resources that Ochsner brings into West St. Tammany in our partnership, Ochsner Hospital for Children at St. Tammany Parish Hospital.